Welcome back. I am Chatrium. Now the news in detail. Tripartite core group workshop on medical imaging feedback organized by TCG, comprising representatives of the government of the Union of Myanmar, ASEAN and the United Nations, was held at Chatrium Hotel in Yangon, Monday. First, Chairman of TCG, Deputy Minister for Foreign Affairs U Chodu, representative of ASEAN, Singaporean Ambassador to Myanmar, Mr. Robert H.K. Chua, and Humanitarian Coordinator of UNIAXC, Professor Adik Wibowo, extended greetings. Next, Member of National Disaster Preparedness Central Committee, Minister for Health Dr. Chomlin gave a speech. He said that in 2005, the government of the Union of Myanmar organized the National Disasters Preparedness Central Committee, chaired by the Prime Minister, comprising 10 subcommittees. Immediately after the storm on 4th May, under the leadership of the Prime Minister, Subcommittee for Health formed groups and went to Molemyainjong, Thiabong, Bogale and Lapota townships and provided emergency healthcare services to the storm survivors. Some patients who needed intensive care were shifted to the specialist hospital in Yangon via helicopters. Since then, 7 emergency medical teams comprising specialists, assistant doctors and nurses were formed and sent to more devastated areas in Bogale, Lapota, Molemyainjong, Wakema, Maubin and Yaomya townships. Up to now, 5 batches of specialist teams, totally 616 members, including 201 health surgeons, have provided healthcare services to the storm survivors in Ayeyarwady Division. The Ministry of Health has been providing healthcare services at 12 frontier camps in Tinkhayai, Tinganji, Salusay, Paipangongji, Tinsalu, Kleinpong, Polang, Queenbao, Jainchao, Jongda, Satsan and Kadongani villages, 6 transit camps in Hainji, Lapota, Molemyainjong, Bogale, Thiabong and Didier townships, and 3 base camps in Yaomya, Wakema and Maubin townships by opening emergency health clinics. 3 batches of 30-strong public health department and disease elimination experts have been sent to the storm-hit areas. They gave polio vaccine to the children under 5, injected measles vaccine to the children under 15, gave vitamin A supplement tablets, and psychological care. 6 groups comprised of 4 psychiatrists each provided psychological care services stationing in Yaomya. Specialists, assistant doctors and male nurses went down on the ground to the storm-battered villages along the riverine route by 4 vessels stationing in Bogale, Lapota, Thiabong and Molemyainjong townships. Up to now, 7 medical groups comprising 129 members are giving healthcare services and psychological care services to the storm survivors in those townships. Similarly, since the 6th of May, traditional medical practitioners have given medical treatment in Ayeyarwady and Yangon divisions, and since the 11th of June, they have been providing healthcare services to the storm survivors by vessels. Since the 6th of May, specialist teams have been sent to Konjangong, Kormu, Tonde and Chowdan townships. Medical teams from central-level hospitals, medicine universities, public health university, nursing university and medical research department Lower Myanmar, as well as voluntary teams, have given day trip services, and Yangon Division Health Department is providing public healthcare services. Continuing, the Minister for Health expressed his gratitude to the medical units from international and ASEAN countries for their assistance in providing healthcare services to the people in storm-hit regions. Their arrivals boost cooperation between ASEAN, international community and Myanmar. Their services were of a great assistance to the mission of the Ministry of Health and could strengthen brotherly love and friendship among the team members. It could also foster friendship, understanding and trust among the countries, and experiences could have been exchanged. As a result, the best preparatory measures will be able to made for the next international medical teams to come. Afterwards, there was a short break. When the workshop resumed, the first panel, led by Deputy Director General of Health Department, Dr. Jonyo Singh, and its members, Leader of Indonesian Medical Team, Professor Dr. Muna Lubis, Leader of Laotian Medical Team, Professor Dr. Van Lamborason, and the second Singaporean leader, Dr. Arif Tarubeli, and the second panel led by resident representative of WHO, Professor Adik Wibowo, and its members, leader of Thai medical team, Dr. Pichit Siriwan, leader of Vietnamese medical team, Dr. Leong Khu, and leader of the Philippines medical team, Dr. Arno Rivera, presented their field trip experiences in the Stonehenge regions. They later answered the queries raised by those present. In the afternoon session, the third panel, led by member of DCG, resident representative of UNICEF, Mr. Ramesh Resta, Counselor of Chinese Embassy, Mr. Tang Yuge, Mr. Kwan Ge-cho of Korean Intercooperation Agency, KOICA, Mr. Mitsuji Suzuka, and Dr. Suek Sunui of Japanese Embassy, and Counselor of Bangladesh Embassy, Mr. Mohammed Ghulam Mustafa, made video presentation on their field trip experiences in the Stonehenge regions. Next, Director of Marine Emergency Response, Mr. U.S. Kim Kretz, explained matters on cooperation in international health assistance. Later, Dr. Richard Garvey of WHO discussed the experience on cooperation of international organizations. During the workshop, Mr. Sanjay Gupta of Garti and Naresh Kumar of Vimpex Limited donated over 23.9 million just medicines accepted by member of National Disaster Preparedness Central Committee, Chairman of Health Subcommittee, Minister for Health, Dr. John Yin. So much for now. Stay with us.